I love to talk to women who are powerful and successful, but especially in the medical field. And Pauline Grant is here in our studio, and she is the CEO of the Broward Health North.
Health North.
Right, and it has changed its names from time to time, but I really love that hospital because I've had a lot to do with it. I was telling Pauline before we started that my mother, in her later years, had some Alzheimer's. We didn't know it was Alzheimer's until we went to the Broward Health, and it's really called the Memory Disorder Center, although I nicknamed it the Memory Center so she'd go and have more memory. And they did a lot for us, and it was really a wonderful thing. And I know that you have some it has great credentials, and you were just telling us. Tell me a little bit about it.
Well, our memory center, or not disorder, is an outpatient center where we provide services for patients who have dementia problems or may have Alzheimer's, and it's really run by Dr. Murray Todd, who is a wonderful, wonderful neurologist. He's been in the community for many, many years, and he's dedicated to providing services to patients in our memory center. And we recently, about 4 years ago, we received our Joint Commission certification, and to date we are the only memory disorder center in the country that's accredited by the Joint Commission. Now what that means is that to be accredited by the Joint Commission means you have to maintain certain standards and certain outcomes. And so we get re-credentialed every 2 years to make sure that we are providing services at a certain level, at a certain high level, to all our patients who come through. So we provide services to the patients who are suffering from Alzheimer's or other dementia problems. But in addition to that, we support the families. So we have what we call a nightcap program where we provide services to patients and their families. Because when you are a patient who has Alzheimer's or dementia, you have to take care of that the disease, but it's the families who you have to really support and help them to deal with what is could be a very debilitating diagnosis. So we do that, and we work with our social workers and our physicians and all the staff in the memory center to provide that services to our patients.
Pauline, when I first got into this the healthcare field, I remember a book called The 36-Hour Day, and I thought, what is that? And after reading it, it is about what it's like for a caregiver to be with someone who you can never take your eyes off.
Right. And that's what we do, because it's really very difficult, but it's manageable. And so we have staff coming in from different disciplines, financial, legal, social services, to help the caregivers really cope, and from a psychological standpoint as well, helping them to deal with the disease that is afflicting their loved ones.
Okay, so that's one little piece of this big puzzle that you're the administrator for. Tell me about the other pieces.
Well, at Broward Health North, we have a wonderful, wonderful hospital. I love being at Broward Health North. I've been there for 11 years. I've been the CEO for 11 years, and it seems like only yesterday because we're having a wonderful time. I've been with Broward Health for over 20 years in other capacity, but I've been at Broward Health North for the past 11 years. So what we do, we provide services to the community. We're a level 2 trauma center. That means that we provide trauma services to patients from the beach to the Everglades and from the Palm Beach County line to about Commercial Boulevard. So we take care of all the adult traumas. And so we have physicians who are in-house, trauma surgeons who, once the ambulance brings a trauma patient, in fact, they tell us before they get to the hospital, so we know their expected time of arrival, so we are ready to take care of the trauma patients. So our emergency room sees about over 61,000 visits a year. So we are pretty busy. And in addition to providing emergency room services and our trauma services, we are best known for our neurological services, our neurosciences program. We were one of the first hospitals in Broward County to be accredited to receive the designation of Comprehensive Stroke Center. What that means is that we provide the highest level of care for patients who are suffering from a stroke. Now, when you're suffering from a stroke, you should immediately call 911 so that you can get to a hospital, because time is vitally important. So if you get to a hospital quickly, so we can take care of if you're suffering from a stroke. So what that means for comprehensive, it really means comprehensive. It means that we can provide, we have a neurointerventional neurologist who can provide interventional neurology services to our stroke patients, to do coilings and, to remove blood clots from the brain to help to, reverse the symptoms of stroke. So we are able to do that. And then we have a cadre of other services, diagnostic services. And then the recovery for stroke is important. So our inpatient rehab unit, our 30-bed inpatient rehab unit helps to support the recovery of our stroke patients. So it's all of us coming together to take care of our stroke patients. So in addition to that, so we have stroke, we have comprehensive stroke, and our neurological services, which our memory center also falls under that umbrella as well. We provide joint replacement for our patients. In 2012, Broward Health North provided most hip replacements in the state, did more hip replacement in the state of Florida than any other hospital. We do almost 900 joint replacements, which is hip and knee replacements at Broward Health.
You are bowling me over with these facts. I mean, I thought I knew the hospital, but I am even more impressed. I just can't even fathom that how can you possibly have enough time to manage all these departments, Pauline?
Well, the thing about a hospital is the people that make it work. It's the physicians. We have a wonderful group of physicians, and our staff really love what they do. And our focal point is our patients. Our patients, every day we come to work is because of the patients while we're there, and we want to provide the highest quality care for our patients. We want to provide excellent care, and we want to cause no harm. So we want to get our patients better and work with the families, and that's why we love what we do. That's why we have some of the best customer service scores and the best quality outcomes for our patients, and that's what Broward Health North is all about.
Woo! I'm going to let you take a deep breath. It's fantastic what you're saying because, when you drive by the hospital, it is an older hospital and people have no idea. I've always said it's not the bricks and mortar. It's what happens inside a building. And I say that for a lot of the various residential communities. We have a lot of senior communities, and sometimes they're not the brightest and shiniest, but the people inside care so much for them. And I think that's what you have at the hospital. One thing that I was privileged to attend was the opening of the A.J. Acker. It's really simulating what nurses and other hospital people have to go through?
Right. So what we have, a few months ago, we opened what we call the virtual hospital. And this was through the kind donation of A.J. Acker, who is a philanthropist in the community. And what this does is that it simulates different diseases and different symptoms in a patient. So a new nurse, through simulation, and it simulates everything: high blood pressure, cardiac heart attacks, and so then the new nurse is able to work on the little
dummy. It was a dummy.
I mean, we have a pediatric one, we have an adult, and they're able to to work. And so they can see what they have done, and it's all electronic. And their videos, they're videotaped as they're actually performing the skills, so they can look back and see where And it's going to be used for all our new nurses, for our for in services for our nurses who are presently working in the hospital. So it's really the cutting edge. It's really very new, and we're the only hospital, I believe, in Broward County that has one of these virtual.
I was just going to ask you about that. So are you going to allow some of the other Broward Health hospitals maybe to use this?
It's really for all the hospitals. It's really been run through our Department of Learning. With Gene Seaver, who is the director for that department. So it's for all our hospitals, for Broward Health Medical Center, Imperial Point, and Coral Springs, and all our other facilities. They will all be working with in our virtual hospital.
Well, I think we were all of us who attended were just amazed to see what. And I did have A.J. Acker on my show once, and she was thrilled about being able to do this. I mean, she has enough money that she could figure out what she wanted to do, but this really turned her on. Of course, she was a nurse.
She was a nurse.
Yeah,
right.
a nurse.
Yeah.
And she thought that this was so needed. So now when I go to a new nurse and they're going to inject me, I can figure out that they've already had a practice.
They probably practiced on the mannequin.
Well, that was good. She must have been very impressed with you, and that's why she thought that that hospital there was the right place, because she actually lives in a little different area. So it was nice that she gave it to you.
Yeah, and I think it's located at Broward Health North because it's central, so it's easy access for the other hospitals as well. So we donated the space.
Yeah, it was really great. And I also know that you have a lot of conferences. You have a lot of open houses for people in your community. You're very much of a community hospital, I believe.
Absolutely.
You know, when you think about it, I know that people used to think of hospitals as a scary place. They didn't want to go there. I'm going to die there. But that's not what's happened. Everything's reversed now.
And rightly so, because I think we have to take our services and reach out to the community and help them to understand what it is that's going on, what we're doing in the hospital, and also to provide services out in the community for the residents. And so we do a lot of health fairs. We do, for the different communities, we go to Central Village, we go to John Knox Village, we go to Lighthouse Point. We just reach out and we do many activities. And it's really helping the residents to understand what services we provide at the hospital, but also to do some simple screenings like blood pressure tests or blood sugar. And, many times when we go, we've sent, residents to the ER because perhaps, their blood pressure is higher than it should be. And so it's really a service to the community. I believe strongly that we need to reach out. We need to go beyond the walls of the hospital. Because once you get to the hospital, you're pretty sick most times. And so it's a way of giving back to the community.
Well, I'm sure glad that you're there. In 11 years, I can see why you know so much about it. Well, you just had a very big grand opening, and we want to talk about that.
Absolutely. Music to my ears. Yeah, we are an older hospital. We've been in the community for over 50 years. And so it's time, for some new things from a structural standpoint to happen at Broward Health North. So about 2 years ago, the Board of Commissioners approved us to have a $70 million expansion planned for Broward Health North. And this is what's we're gonna be doing. We're gonna be building a brand new emergency department in new space, immediately adjoining the existing emergency department. We're gonna have 53 new universal rooms. So that's gonna be, of those 53 rooms, 3 of those rooms will be for trauma bays. Because, as we're level 2 trauma, taking all the adult, we'll also have 3 rooms for behavioral health. And then we do see some pediatric patients as well that are, if they need to be admitted, they go to our sister hospitals. So we'll have some rooms dedicated for pediatric patients. So we're going to have 53 new rooms, brand new patients, because we anticipate that over time we're going to be seeing more patients in our emergency department. In addition to our new emergency department, on the second level of the new construction, we'll have 6 new ORs. So remember I talked about our joint replacements, how many volume. We also do a lot of spine surgeries and brain surgeries as well. We have, which take a longer time. They're more complex and we need more OR space. So we'll have 6 new ORs. So that's not finished yet. We're also going to be building a new central energy plant. The hospital is old, so we have old generators that are still functioning and are still doing a great job. But when you add new square footage, you need more power, more energy, more generator capacity. So we're going to be building a new central energy plant that's going to then be connected back to the hospital. And then we're going to give the entire building a new facade with new signage. So in about a year and a half, we'll have all this construction should be completed, because we're at the phase now where we have gotten Agents for Healthcare Administration approval for the design. We've gone to the city of Deerfield, got the appropriate approvals. So we are well on our way, and construction should start in about
I don't know how you're
October.
sleeping at night, but I want everyone to know who I'm talking to. This marvelous woman, Pauline Grant. You would never believe. I always say, give a big job to a woman, and you can attest to that. But for those of you who don't know where the hospital is and you're listening to the show, if you're driving on I-95, you're going to see a building looking east on Sample Road. And that's exactly what we're talking about. It's a big hospital, and when you do the new facade, I'm sure people will really recognize it even more so. So Pauline is a person who, you came up, I guess, from the ranks, and you've been there 11 years. We always thought of CEOs of hospitals as being men. Maybe I'm just old-fashioned. And now, of course, I've talked to Alice Taylor, who's over there at Broward, Imperial Point, and now you. So is this maybe the new woman's position?
Well, at Broward Health North, there are 4 CEOs of each of the 4 hospitals, and 2 are 50-50.
That's good.
2 are female and 2 are male. So, maybe it's our time now.
Yeah, I'm sure it is. And also, your gift shop is charming. And I told Alice the same thing. I'm into gift shops because sometimes I go there, I don't even have a patient that I'm taking this to. That's all run by volunteers. Talk about your volunteers a moment.
Our volunteers are an integral part of the hospital. They wear the pink uniforms because we lovingly call them the pink ladies. But they run our gift shops, and but in addition to the gift shop, they volunteer, transporting our patients, giving directions to our patients, delivering newspaper, delivering magazines, and just being there for our patients. And we calculate that every year we have an annual recognition for our volunteers, and we calculate based on the number of hours that they donate to the hospital, we would probably have to add another 20 employees. That's how valuable they are. So we love our volunteers. We would love other people to come and volunteer at the hospital. So if you ever get a chance, just call us at the hospital. They could call my number, and we'll
I'm going to give them the regular number. I think if they call 954-941-8300,
that's correct.
They can then ask for, I'm sure you have a volunteer coordinator, and they can get started doing that. So I don't want people to be afraid of hospitals. Just what you've been sharing shows that it's almost a community within itself.
It is, and we're here to take care of the community. And when you come to the hospital, it could be for an outpatient procedure, it could be for inpatient. We want you to feel confident that we have competent staff, we have outstanding staff and physicians who are there to help you to get better. Because I keep saying that the reason why we do what we do is because of the patients. It's because of the patients and their families. That is the most important. That's our focus for everything we do at the hospital. So don't be afraid. We're here to help you. We're going to hold your hand. We're going to help to make you feel better. And if there's an outcome that is not desirable, then we're also there for you as well.
And when are you expecting the new building to be? I know it's a hard thing to figure out. 2 years?
We expect that by December of 2015, the ORs, the operating rooms should be completed, and the emergency department should be completed by the latest March of 2016.
But the amazing thing is that you're doing everything and getting awards and being approved for everything, even in the condition that it's in, because people would not know. This is all something that's on a drawing board and that but most patients, I don't think, understand what you're wanting.
Because, for us, it's, yes, we want to make the building look nicer and pretty and more pleasing to the eye. But as I keep saying, it's the people. Mm-hmm. It's the people that make the hospital what it is. It's the people that are important. And we have the most outstanding staff. We have a forum, and I call it an employee forum that I do every quarter. And all the employees, it's mandatory that they come, and I do 10 forums, and I speak for 30 minutes for each forum. And the objective is to give everybody an update as what's going on in the hospital, because every person that comes through those doors as an employee or as a physician is important to helping us to achieve our objectives. And my job is to be able to articulate that in a way that they understand their role and how important they are, because it doesn't matter who you are, because you help to make the hospital run. And
you, of course, have a budget, and it must be very difficult to know when you need a lot of things. How do you prioritize that?
Well, usually we based on our program, based on what our initiatives are, we start out by looking at what our strategic initiatives are going to be for the year, and then we would prioritize based on that. So we have a new program that we're going to be starting, and or what our emphasis is going to be on, because we know what our core business is. It's neurosciences, it's orthopedic, it's we have a cancer program as well. So then we would prioritize based on what our initiatives are.
I'm glad you brought that up, because I went to an opening many years ago, and it was all about the palliative care. It was, I think, a nun was in charge or something at your hospital. It was. I forget what that was, but it was wonderful. And I didn't even know about palliative care. I mean, I thought it was just hospice, but it isn't hospice. Yeah. It was different.
Hospice is different. Palliative care is helping to keep the patient comfortable, and Dr. Sutton was the physician.
That's who it was.
Who worked at Broward Health Medical Center, and so we have other physicians at Broward Health North who provide palliative care. It's helping to keep them comfortable, as opposed to hospice, which is it could sometimes it's get a little murky between the two. But it's really providing medication to help the patient be comfortable.
Well, the thing is that this the equipment nowadays costs so much money. And I know everybody wants all the finest equipment. But I see that there's something called a CT scanner. Tell me about that.
That's, we have a 128 slice CT scanner. It's one of the newer scanners. It's part of to be able to diagnose. Part is that piece of equipment that helps to diagnose what's going on with the patient, and it's provides it's very accurate, and so we have a 128 slice, and we're one of the few hospitals that have that.
And so when women want to have mammographies and they want to really get taken care of, what do they do this through their doctor, and you have all the proper equipment there to do that?
Yeah, we have our mammography unit, and they can come as an outpatient. The doctor can write a prescription. They call us. We schedule, and we do the mammogram. And in fact, in October we have what we call Mammapalooza, where we do many mammograms, because we want to encourage all women to have a mammogram at least once a year, and and then those results would then go back to their primary care physician.
That name sounds like something that Lynn Clark, your marketing director, probably came up with. It's a very clever name. What's it called again? Say it again.
Mammapalooza. And Lynn started this. Lynn is our marketing manager, and she started this actually about 4 years ago, and then it's been adopted across all the entire Broward Health.
I see that everyone encourages that. Yes, so what are we doing for the men?
We're going to have prostate. For the men, we do prostate screening.
It's not called prostate.
No, no, we didn't go that far.
Right. Well, no, but I'm really glad that you have been at the helm of doing this, and you must feel pretty good about yourself, and that you have been there to be able to see all these new things now going to emerge. I mean, going back to the Memory Center and thinking about a woman there, Shelley, who I knew for so long, and she helped my mother. But Dr. Todd is a very unusual man. Do you know much about him?
I know a lot about Dr.
Okay, tell us about Dr. I have to tell you, I listened to a lecture. He is hysterical.
Dr. Todd is a neurologist who has been in the community for a very long time. He has been at Broward Health North for probably in the late 60s, 70s, and so the thing about him is that he is so passionate about what he does, and he's so caring, and he's the only physician that provides services in our memory disorder center, our memory center, and he's our medical director. And he cares about his patients. He cares about the families. And he's just a great physician and a great person. And
have you heard his lectures? They are funny, aren't they?
They're very funny. And he talks about eating blueberries
and eggs. Eat all the eggs you want. He says not a.
He talks about. I mean, because of him, I eat blueberries every morning. because I hope that my memory will last I'll have memory for a long time.
So will he be director of your new neuroscience
Absolutely.
institute?
He's going to be he's the medical director.
So we're looking for some donors out there for this because it's a very big number, but we are looking for people who they could put their name on whatever they, however much money they're going to bring. I'm here on a little bit of a fundraising here to help everybody because I always feel that people do have money and they don't, they, a lot of times they put it in their will or they want to donate it, but they want to make sure it's going to something that's going to be of great value. Is this going to be great value?
This is going to be great value. What we propose to do is to relocate the memory center to the front of the hospital so that to provide easier access and to have like one area where we have all the services for our sleep center or for our memory center include where we treat our patients who have Parkinson's disease or headache clinics. So we want to be able to house everything in one area at the front of the hospital, and then that would then really be connected to our inpatient unit because we have a unit at the hospital that's just dedicated to making for our patients with neurological problems. And the reason we do that is because we have special nurses who are trained specially to take care of patients who have that diagnosis. So we want to put everything together, make easier access, and really provide a broad spectrum of services for our patients with neurological problems.
So the people with strokes also, that's all part of the neurological center.
All part of the neurological center.
And you mentioned the sleep disorders. Do you now, if someone has a problem, can they come there now?
Yes, we do. We have a sleep disorder center. We have three beds, and it's done at night. So you check in, and this studies are done, and that's in another part of the hospital. So we have the memory center in one part, the sleep center in another part. So we want to put everything together so there's easier access and more coordinated among all the services.
And I think I also read that you have support groups. Support groups are extremely important. Will you talk a little bit about those?
We have support groups for our stroke patients as well as our patients and families for Alzheimer's, for our memory.
Yeah, and Parkinson's. I mean, unfortunately, so many people have these diseases. Most of them are neurological. Well, Pauline, I can't tell you what a pleasure it was to have you here. Pauline Grant, CEO of Broward Health North. And Pauline, we're going to be looking forward to having you back again as we get more buildings. And remember, it's the Memory Center. I'm sorry. It's just I had this problem with my mother. That's all, and I remember what I had to do. So thank you very much for coming.
It's my pleasure. Thanks for inviting me, and I had a good time.